Good morning, everyone. She is a tough act to follow. Best I can. When you look at this, don't you feel like you're in a lineup? Just put a number on there. So the topic that I was given is fresh topics in workers' comp. Unfortunately, there's not a whole lot that's fresh in workers' comp. I mean, the statute's been around for more than 100 years, about as long as I've been practicing. So there's not much that's fresh. I prefer to call this news from the trenches. That's where I work. That's where we get things done. So let's start with opioids. Opioids are still a hot topic, both in the medical field and in the workers' comp field. The insurance companies are continuing to sing the same old line. All opioids are bad. Everyone must be weaned down to zero within 2 months, no exceptions. That's been the company line. There are ways that we can fight back. Our firm has been successful in these cases when we have some or all of the following factors in our particular case. First of all, low to moderate doses of opioids. That's 60 to 90 MME. If you're above that, it's a bit of a challenge to get the Industrial Accident Board to say those high doses are good. When we have a treating doctor with a history with the claimant, that's very helpful, especially if the doctor has been changing up the prescription regimen in order to find the right recipe to keep the pain down and the function up. It's also helpful when all other treatment options have been exhausted. When we keep the focus on the specific claimant rather than studies and statistics, we tend to do better. It helps if we have proof of a level of function that is acceptable to the claimant and pain levels that are also acceptable to the claimant. That's why it's important to keep the function on your particular patient, not just patients in general in these studies that the insurance companies like to rely on. It also is helpful if there have been prior efforts to wean down the doses of opioids. And last but not least, it is very, very beneficial to have a credible claimant. So I want to share an interesting case with you. In this particular case, the claimant worked for a local car company in Delaware, which is no longer around, and in 2005, he injured his back. He began a long history of treatment in Delaware, which included opioids. The opioids, over time, were weaned down from a top of 250 MME to 60 MME. And for those of you that don't know, because I have trouble remembering this, MME is a morphine milligram equivalent. That's a term that the CDC uses, which we're going to talk about in a minute. So the claimant then, after this long period of treatment in Delaware, moves out of state. He goes down south, and he has to find a new provider. Workers' Compensation finally decides that after all these years, that's too much medication, the opioids are too high, he needs to wean down to zero. The defense medical expert testified that the claimant was at potential risk for abuse of the medication and even death because of his comorbidities. The DME testified that the claimant must be weaned down to zero over a 2-month period. Surprisingly, the Industrial Accident Board said, no, we're not buying that. They cited many of the factors that I just mentioned before in favor of the claimant. Now, here's the best part. We did that case without a medical expert on our side. We were able to focus on the claimant. The claimant testified very credibly about how he was able to function in his day-to-day life on this level of medication. He testified about how he takes care of his 83-year-old mother who is not in good health and needs a lot of care. He testified how about he can take care of himself on these levels of medication, and it made a big, big difference. So while we always want the support of the treating doctor In this particular case, it was just not possible, and we were able to win the day with the claimant. So in other words, basic common sense prevailed in that case. Now, we may have a new weapon. The CDC put out new guidelines in November of 2022, just last month. Now, I've read those guidelines as best I can, and if you folks have ever read the CDC guidelines, after about 10 minutes, your eyes start to spin around in opposite directions. But here's what I gathered from that. The CDC recognizes that tapering is a good idea. Nobody should be on super high doses of opioids. But they state the rate of tapering should be individualized to the patient. Tapers can take months to years. So it's got to be done in 2 months doesn't seem to fly anymore. Tapers might have to be paused and restarted. Now there's an idea. We've argued this in the past. He tried tapering, it didn't work. Something else was tried, and then he started it again. That didn't used to work in the past. It might work now. Since these guidelines are so new, the IAB has not issued any decisions which comment on them. So stay tuned. Perhaps this time next year, we'll have some news for you on those guidelines. So here's a topic that's been hit 3 or 4 times today already, but I'm going to say it anyway. Workers' compensation certification. It is still required unless you want to ask for pre-approval each time you provide treatment. Now maybe you're thinking, well, I let my certification lapse, so what? What's the big deal? Well, as was mentioned, in a recent decision by the Delaware Supreme Court, the court said it's a very big deal. A surgeon in that particular case who had let his certification lapse and then performed spine surgery is not going to be paid for his services. The Supreme Court said certification is just what it means. If you're certified, then you don't need approval. If you're not certified, you need pre-approval. This surgeon did not ask for pre-approval. He's not going to get paid for his services. So it is a big deal in that case for the surgeon and for the patient. Another topic that seems to be coming to the fore is stem cell treatment. This was examined in a September of 2022 decision by the Industrial Accident Board. This procedure was recommended in order to avoid another lumbar spine fusion procedure. You would think that a recommendation that was made to try to avoid yet another lumbar spine fusion surgery would be welcomed by the board. After reviewing the evidence, the board issued an interesting ruling. Here's what they said. This procedure, which had already been done, by the way, was related to the work accident and was perhaps even necessary to try and avoid surgery, but it was unreasonable and therefore not compensable. The board was concerned by hearing about warnings put out by the FDA on this procedure, at least as far as it pertains to spine procedures. The board said that if it is, or the FDA said, if it is to be used, the patient should be in a clinical trial or have a special use permit from the FDA. That didn't happen in this case. The board concluded that the procedure was, quote, experimental and relatively controversial, close quote. Also, it did not help in this particular case that the claimant did not receive the relief that he had hoped for. I'm quite certain we're going to be hearing more about this in the future. To the best of my knowledge, this practice has not been added to the practice guidelines. Speaking of medical marijuana, this is not a fresh topic. Those of you that have come to these meetings in the past have seen me do my routine with the lab coat and the exhibits. Couldn't do that today because it's no longer a hot topic, but it remains a viable alternative to the opioids that I talked about previously. You still need a card as a patient to get medical marijuana, and you still need the assistance of a qualified provider to get the card. I have seen some interesting questions come up over the years since our statute on this matter was enacted. For instance, what is the ongoing role of the physician once he helps his patient get the card? Should the doctor provide some type of oversight? Should the doctor do regular testing, drug testing? Should the doctor provide advice and counseling on what products to use? How much of the products should be used? Does it matter if the products are smokable, edible, dabbable, applied on the skin, applied under the tongue, drinkable, or vaped? Does it make a difference? Does it matter where the products are purchased? We now have several dispensaries in Delaware, as opposed to just a few years ago when there were only 2 or 3. We have dispensaries in neighboring states. Can you go there to get your medical marijuana? And you may be surprised to know that medical marijuana products can also be purchased online and delivered to your house just in time for Christmas. So, those are questions to which I don't have answers. But I have some more questions for you. Is cost a factor? I have seen a huge range in the cost of medical marijuana products. Just like the difference between a car they used to call the Yugo, if you remember that, and a top-of-the-line Porsche nowadays. I've seen that discrepancy, right? You've seen it. Okay. Now, medical marijuana is not in the fee schedule or the guidelines. Prices do vary. And then the question is, okay, so what's a reasonable price for a product that you can't get at the drugstore like you can get Oxycontin? Another question, can the comp carrier be compelled to pay a dispensary as they would pay a pharmacy for other medication? These are all good questions, none of which I can talk too much about because I have a case going on that some of these are going to be answered in. So I don't know the answers, but those are things that need to be considered if your patient wants to try medical marijuana. I want to end on a high note. Do I have time, Uncle Eric?
Yes, you do.
All right, thank you.
Uncle Eric.
I want to end on a high note for claimants. Surgery cases are always difficult. Repeat surgeries or additional surgeries are even more difficult to win in front of the Industrial Accident Board. Here's the case that I want to talk about. This young lady had an acknowledged low back lumbar injury. She underwent 4 lumbar spine surgeries, all of which were determined to be compensable. And then her surgeon comes back and says, I think she needs thoracic spine surgery. The insurance company, of course, goes ballistic. They said, no more surgeries, forget it, we're not going to pay, you got to go to the board. Surprisingly, the Industrial Accident Board said yes to the thoracic spine surgery, and I want to look at why they did that. The claimant's surgeon did an excellent job of convincing the board that there were thoracic spine symptoms and complaints from the very beginning, but her lumbar spine was so bad he had to focus on that before he could get to the thoracic spine. The key to his testimony was a form that he referred to as the little man form. Are you familiar with these when you give it to your patient as a little body, it's a body standing like this, and you're supposed to show where it hurts. That's all, just show me where it hurts. This woman had the presence of mind to point out areas of the thoracic spine where she was having complaints with radiation going up the spine as opposed to down to the lower extremities as you would with a lumbar spine problem. Cross-examination by the defense attorney of this doctor was entertaining, to say the least. Well, doctor, what exactly on this form does the cervical spine end and the thoracic spine begin and then end and then the lumbar spine begin and end? And the doctor's like, are you kidding me? Look at it. She's saying that it's going up her back. That's not lumbar. And he was very convincing on that. Now, it didn't hurt that the claimant was very likable and very credible. 2 more things, if I have time. Couple minutes, and then I can keep going. Practice guidelines. You hear about those all the time. Now, if you are providing therapy or chiropractic services, please, if you have to testify, know those guidelines inside and out. Know them better than the defense attorney. One of the best questions, or worst questions, frankly, they like to ask is, well, doctor, how many treatments are you allowed under the guidelines? If your answer is, I don't know, I have to get back to you. Not helpful. Doctor, how many times in a week or a month can you treat somebody with this? They get back to you. It doesn't work. And you talked about insurance. One comment about uninsured employers. If you have a patient that says, man, I got hurt on the job, but they didn't have any insurance, doesn't mean they won't have a workers' comp claim. There are ways to get money out of an uninsured employer, even if they don't have a policy. And with that, I think we're done. Thank you.